of introducing my friend and colleague, Dr. Mónica Pérez Jolles, who we're fortunate to have as a member here, one of our core faculty in implementation science at the University of Colorado School of Medicine. Um, Monica is rapidly becoming known not only nationally but internationally, I think, for some of her work. As you can see here, technically, in terms of the associations here, she's associate professor in Department of Pediatrics. Honestly, like I do, she spends most of her time at our Accords multidisciplinary research center there. Monica has a variety of interests, a lot of them under the rubric of complex systems theories. His broad work and background in health services research in general. Recently, she's doing some real exciting work in partner engagement and assessment in engagement or co-creation. That might or might not come up today, but today she's going to talk with us about some of the latest, I think, exciting things on her functions and forms and some new resources related to that. So with that, I'll turn it over to you, Monica.
Good morning. Thank you. That is very kind introduction. Thank you, Ross. Again, thank you for the invitation and for all of you attending. A little caveat, I'm just recovering from one of the worst flus I've ever had. So bear with me. If there's something that doesn't make sense during my presentation, I'm going to blame it to Dayquil. And if things make sense, it's because it is great material that I'm presenting. So bear with me, and it's the first day back after a full week of being ill. And I am very enthusiastic to share with you a project that has been on the works now for 2 years. And I came here before to introduce the web tool. As you may know, at Accord and with our colleagues, including Ross and others, we focus a lot on developing pragmatic, actionable tools to help us in our field translate evidence into practice, tailor, adapt, implement. And this is one of those tools. So I came a while back to introduce the web tool, and now I'm coming back with an update. So my presentation sharing to all of you will be just a relatively quick refresh on the web tool, because you may not remember if you were in this presentation, or you may be new. And then I'm going to focus on a new aspect of the web tool, which is a core functions and forms repository. I have just a few slides, but I'm going to do mostly a demo in the actual website. And yes, part of my work is also, and you will see my rationale why, co-creating with our partners. And if there is interest, I would love to come back to this group at some point to share our work on Science of Engagement, a project funded by PCORI, where we are developing a validated measure of co-creation as a type of partner engagement. And our measure should be available in May or June. So a little bit of plugging for that work since Ross mentioned it. So let me share my screen. Again, just a few slides. I like visuals. I hope you do as well. And then I wanted to share the actual website with the tools. As always, this is not a solo endeavor. This is a team effort. And you see the names of amazing collaborators, and for this new repository, including Jennifer maybe. So I wanted to recognize her name as helping us with this new core functions and forms repository. Very briefly, I always like to start here. It's one of the areas that resonate in our field, but for me, and it's context. As you know, context reflect the richness, diversity, and resources of our local communities, where we want to test and implement solutions for the communities that you care about. And for implementation and health equity, my take is that means really understanding and being responsive to those environments. And if you have heard me speak before, I always like to start here. I see active partner engagement as so critical in our field of implementation science, but also for health equity, because it's very difficult for us to do that, help be responsive and really do our best to understand environments by ourselves as researchers, for example, or policymakers alone, or even healthcare providers alone. So we really need the team effort, while also recognizing that for good or bad or worse, our environments, especially community-based clinics, for example, I work a lot with federally qualified health centers. These environments are dynamic, they evolve, they self-adapt, they make decisions on their own to adjust to constantly changes in funding policy, multiple needs from patients, for example, or at the population level. And this is often called complex environments, not necessarily complicated or chaotic. They're different, but complex in terms of the dynamic nature, interrelated pieces, self-determining. They make their own decisions, these environments. And sometimes that can be an issue where we're trying to implement and nicely evaluate a solution. Well, environments have different ideas quite often. And that means we require multi-level solutions. So this work on functions and forms can resonate for you if you are in the area of developing, designing, testing, or implementing solutions where there are several things happening at the same time. There's change, promoting change at different levels, at the healthcare system level, at the patient level, community level, policy level. These concepts, again, can resonate with you in this area for these environments. Some may argue which interventions are not multi-level or dynamic. That is a valid argument. So these concepts of functions and forms have been coined by Penelope Hall in the early 2000s. And in my work with my colleagues, including Ross for the past several years and others, we have been taking these concepts to further develop these concepts. And the first step in 2019 with Brian Midman and Rebecca Legning Hall in California was to further develop the definitions. What do we mean by functions and forms? So I just like to stop briefly here because these concepts are quite abstract. So I always like to start, what do you mean by that? Very briefly, and there are some additional readings if you're interested on diving deeper into these two concepts. They are informed by complex systems thinking, among other areas of the literature and fields. But think of core functions as the goals or purposes for your solution that really need to be informed by the theory or framework because it's linked to the mechanism of change. So what is it that you need to do to bring about change? What needs to change? What are the skills, knowledge, systems that require some type of change to bring about specific changes, clinical, even in implementation outcomes? The purposes or those goals are the core functions. And we talk about fidelity, functional fidelity. So we preserve those. Again, they're linked to the theory of change, that if we change it too much, if we adapt those core functions, we might be changing the intervention. We might not have fidelity to that mechanism of change. On the other hand, how we carry out those purposes, they're still abstract, is a goal. We really need to translate those into action. That's why it resonates, these concepts with this field and hopefully with you in implementation science. Forms refer to activities, procedures, workflows that are tailored to local environments that are going to allow you to carry out or deliver those core functions that to make sure that they are actually happening. And they are tailored, they are flexible, they can evolve to adapt to changes in the environment. I have found and others these concepts to be incredibly helpful as one way, not the only way, but one way to understand, okay, what do I preserve and what can I tailor, adapt, or change? And how do I do that? How do I identify these core functions and forms for my intervention? So that's in part these readings, but also the web tool. And here's in part what I was saying. That sounds great, but how do you do that? So this is another question I've always pushed myself to answer. That sounds great. What do you mean by that? Let's define it so we can measure it and test it. And then that sounds great, but how do you do that? Can you help us guide that process? So here is the core functions and forms web tool. You have the QR code here. I'm happy to share these slides. The link is here, but I'm going to switch us now to the actual web tool to walk you a little bit on the main areas that you will find there. Remember, it's a web tool, so we really needed very minimum text and very short sentences. So this is one way of supporting your efforts. And I wanted to ask while I switch, who has heard of functions and forms or have used or take a look at this web tool? Any hands up, either real hand or your virtual hand? I see Lydia. Lydia from Brazil has used. Yes, thank you, Lydia. We have actually been working in this area, and Lydia represents an amazing team from Brazil as part of our international collaborations. Ross, thank you, Ross. 2, that's not bad. Any other hands? Thank you. I see Shawi. I know I'm mispronouncing your name. Thank you. Yes. And Peyton, I've heard of it, but not very familiar. Thank you. I appreciate you sharing. So a few folks have heard of this web tool. So let me share. You probably have it in your laptop already if you follow the QR code. It's freely available. And I'm here again because I want to focus on the new area. I just wanted to highlight that it's divided in 3 sections. And with input from a lot of individuals that I shared during my second slide, we did 2 rounds of user testing sessions spanning over a year, almost a year. And we incorporated input in, and we continue to refine this web tool. It's not completely finished. I don't think it will ever be finished. But here we share a little bit of what we mean by complex interventions. So here's some cues, some bullet points on what that means. Then we define functions and forms, and we design this web tool always with examples. Give me an example. What was it that you said? How do you apply it? So you can see here complex interventions. Here is a clinical example of a funded NIH project. And here is an example in the implementation side. And we just plug in an example in the public health space. Then there are here some resources. If you want to have some readings, you can incorporate some of these resources as citations for your papers or grant proposals. And something that is new here is my colleague, good colleague, Reza Youssefin at Rochester University is currently developing an ACT model, ACT, and it's at the system level, and he's using functions and forms to guide that process. And he has a very cool website if you're interested. I have just added this recently, the ACT model, if you're interested. Then we define functions and forms, and there, give me an example of functions and forms. What will that look like in a funded project? This is a pilot with Russ, Amy Hopshman, and others, as well as a public health example. And then we offered to you 3 pragmatic tools to identify and track functions and forms. So you can see here, you can download a matrix where you can work on your own with your research team or as part of a mapping activity with partners on identifying the needs of the system, what will be the purposes or the goals, core functions, and then how are you going to make it happen? What will be the forms to carry out each of those core functions? Then we offer an aligned intervention guide, interview guide for qualitative methodology. And the last one is a PDF document, suggestions adapted from other tracking approaches such as MADI and others, a way of tracking functions and forms over time, and offers a little bit of information how we have done it, but I'm happy to follow up later if you're interested on how I have applied these tools in my research or during our Q&A. So they're all downloadable. And again, I really want to focus on the last section, but let me just see if I can open one just to give you a flavor for what, yes. So here is the matrix with a short how to use suggestions for how to use the table. Sure, and you can see a table here where you can actually enter data with your partners, the name of your intervention or solution, what is the local context, the dates, comments, and you can start just fleshing out a little bit more, mapping your multi-level intervention. We have another format that I call Fiesta, very Latin oriented with a lot of colors if you like it, but another format that you might find helpful and you can download it. Here are more detailed instructions step by step on identifying the who, the needs, the why or core functions, the how or forms, and with a concrete example. This is the matrix we developed, but the paper is also citation included with patient-centered medical home. We did a full application in this, applying the matrix and some readings. So that's an example of using one of the 3 pragmatic tools that hopefully you find them helpful to either conceptualize your intervention, map it, and or use that information to inform your evaluation efforts. All right. So now let me go to my slides for the last part. Maybe we can even leave a full half an hour or so of just questions and answers, but I also have questions for the group where I would love your input. Let me see. Oh, here. Okay. All right. So we started developing this web tool, as I mentioned. Give me definitions, give me resources to read. I just shared those. And then help me understand what's a complex intervention, functions and forms, but show me examples. And then later on, we had 3 concrete tools that you could use to map them, these concepts, to dig deeper through an interview. It can give you ideas for questions in your own interviews and a way for tracking the functions and forms over time. Then the next question has been going around for many years among some of my colleagues and part of my work, and is, okay, if we are identifying core functions and forms of different solutions, your programs or interventions, do we have to start all over, recreate the wheel every time? What if we have a space where if I am getting ready to adapt an intervention or create a new one, for example, I want to know if someone has already tested or even defined core functions and forms in this area. So I can use that as part of my work as a starting point to either replicate or build on that. But could we have a centralized place where we can find functions and forms in different areas? So the answer is yes, we're working on that. And that is the core functions and forms repository. By the way, I thank Brian Midman on this acronym CF/NFs, that's short for core functions and forms. What is it? So I just mentioned it's a way where we're hoping to start collecting from the literature and from all of our networks and colleagues, any published studies or projects, pilots, where functions and forms have been defined, tested, evaluated, included in research or program evaluation. And so we can come here and see if there's something already done in this area. So now I'm going to switch from this slide to the actual website. And I'll share with you how so far we have structured this section, but it's not easy. We have gone back and forth with Ross, Justin, Samantha Rubio has also helped in this area, on how to best structure this repository. So you can see here that we start implementing or evaluating an interventional program. Take a look at the repository to see if core functions and forms have been published in your content area. This is just the beginning. So we started thinking, okay, can we list interventions, actual interventions, and then extrapolating, illustrating the functions and forms. So we started putting it together, and then we realized it might not work because if I don't know the name of an intervention, I can't find it. So now we switch it to content areas, and I'm very curious to see what you think, or if there's another way to structure this effort, this repository. So what you see here is functions and forms, and we have 3 filters at this point. This is just an early draft phase. But we have health area, population, and setting. So health area, we have so far 3: behavioral health, cancer care, and patient-centered care. So we thought being broader might be more helpful to visitors. So I know if I'm working, I often work on behavioral health and social supports for families. So I can go, okay, I want to know in this area of behavioral health, what can I find in terms of core functions and forms? For population, right now we only have adults, but again, we're just starting because we have a group of candidate projects that have been published where functions and forms have been explicitly identified. So we didn't have to do a lot of interpreting. But we were trying to pull as closely from the studies as possible. So let's say adults, but my goal is to have other population subgroups, of course. And we have here different settings: academic healthcare system, academic medical center, community clinic. Again, this could be, of course, longer, but the idea is that then you can clear them all. You select within these 3 filters. And then we so far have 4 projects that have been funded within these 3 areas of health area, population, and setting. So you can see here the health area, one in behavioral health, one in cancer care with the financial navigation and oncology, patient-centered care with PCMH, and telephone peer support with behavioral health. So you can see that you can actually look at each of the projects, and now it's easy because we have 4, but what if down the road we ended up with 30? So all of these things are in our minds on how do we best design this section. But right now, how we have it is a very short sentence of what this project is about. Again, the filters are here on the landing page. And then you can go to and click on the actual intervention. I just want to make sure it took you also to, yes. Okay. So here you can find more about the program a little bit. Again, remember, it's a web tool, so we can include a lot of text. So that's a limitation, but also something that you hopefully find easier to use and not too overwhelming. Very short description of this Engager program, the full citation so you can go to the source, as well as finding the authors. And what we did was, let's keep it simple to begin with. What are the functions and forms for this type of intervention that is using a realistic formative process evaluation? If you're not familiar, it's a very interesting and often used evaluation framework to look at complex interventions, often used in Canada and Europe, as well as in the United States, but I see it quite often in other countries. So it's a complex behavioral and social intervention for individuals who are transitioning from incarceration. So let's say you're in that space, you're in that area, and you're very curious, what will be the core functions and forms in this area of behavioral health, complex interventions, and we have this table here. So you can see that for this intervention, they focus on the goal of building trust and engagement. That sounds great. How are they doing it? The activities are release day working. supporting the prisoner on the day of release. So they have some steps and procedures on the day of release. They have some procedures for the release day working. They're tailoring delivery to individual context, prisoners with history of substance abuse. So again, the paper has more details. They might have flashed out the forms very nicely in details, or they may have not. Certainly, this was not the original purpose of this team to map a functions and forms table. But it can give us some hints in this direction. Another goal is using sharing participants' personal goals and action plans with their health and social care professionals. That is the purpose that is going to bring about change. That sounds great. How are they doing it? Part of the advocacy and support with appointments at support services on day of release. So they're bringing the individual on day of release, and that person is not leaving until they sit with someone to set up some appointments for support services as how they're carrying out this purpose for our core functions for the Engage program. So again, the goal is for you to, if you are working with this community in this space, in this area, content area, we understand completely still broad, but you have a place to go in terms of looking at a paper, in terms of perhaps talking with that team, but also you will see our table, how we are mapping that intervention in terms of core functions and forms. And this is the example with the oncology, financial navigation, a little bit longer description, citation, and then the table. Some tables are more detailed. We are limited from what we can find in the paper as our first attempt. All right. And that's it for me. Let me see if I have any other issues. No, that's it for me. I wanted to again share the concepts of functions and forms, where you can find a website with very focused, hopefully short information on definitions and applications, as well as resources if you are ready to dive deeper with more readings and who is in this space. You can find that with the author list. But also I wanted to introduce the new section as a new phase with the functions and forms repository, where we are, how we have structured that section, and what is the goal of this section. We want to make sure that it's easy to navigate, but it's also useful, that it's applicable and helpful for your work. And I would love to open it for comments, reactions. I know the chat has been busy, which I am glad and grateful, but also I would love your input. It can be criticism, especially for the repository. We're really struggling hard at best. Structure that section so it's still easy to navigate. We can't include a lot of content because it's a web tool, but it's also helpful for you to find information in your area. So I would love to hear your ideas, suggestions, and thoughts.
Well, thank you so much, Monica. Huge amount of work that I think you can either see or imagine if you've done this type of thing before. From the comments that have come in so far, the initial comments anyway are more, if you will, conceptual about functions and forms. So if it's okay with you, we can feel free to do this differently. But I was thinking about it. It might be useful. We have a fair amount of time to discuss. If we could initially take some time, maybe up to 10 minutes, just to talk about conceptual issues and functions and forms, then turn to the website itself and maybe see about questions people have, and maybe in particular how they can provide you with feedback in addition to today, or if they have things they'd like to add. And then finally, then see if you have particular questions or probes you'd like to get people. So will that work okay for you in terms of that organization?
Yes. So I'm happy to, let's go where we have time, a little bit more on the terms. I can show you the actual examples. I know Shawowi has your question, your hand up. So maybe we can hear from you first. And then my questions for the group are, how do we best structure that repository section?
Okay. Okay. Let's do that, and then we'll go back and catch the conceptual things. I saw a number of people kind of put their thumbs up for reinforcement of those issues. I can help kind of paraphrase that. So,
All right. Please go ahead. Yes.
Yeah, so my question actually is spot on about the conceptualization of functions and forms. When it comes to like a complex intervention, for example, they're not just at one level, right? They can be at the patient level, caregiver, and at the system level. So then say, for example, for patient, it's to instill the hope for them to get better. And for caregiver, the function can be, different than from the patient is feeling support and love. And for a clinician, it may be I really gain skills and grow professionally. So when those functions and forms, they kind of interweaving or intermingle at different levels, right? Like say, these functions can potentially having certain overlapping, for example, between, for example, patient and caregiver, it's feel this love and bonded, but also there is some distinction about the particular motivation of change for patient and caregiver. And so when these levels, they're mixed, intermingled, and interweaving, and so how we conceptualize the function and forms when they're sometimes kind of mix or intermingle together.
Yeah, great point. Yes. So here's my take, and others might feel free to share based on your work or familiarity with these concepts. So absolutely, you most likely you're going to have overlapping levels where core functions might be similar across different groups. I'm sorry, how do you pronounce your name, please?
Yeah, Xiaowei. Sorry, I forgot to
Xiaowei.
introduce myself. I'm a fellow at CU and finished my T32, and I'm currently research associate affiliated with VA.
Thank you. And I know we have spoken before, so thank you for reminding me how to properly pronounce your name.
Yeah,
Um,
Xiaowei.
Shoei. Great. So yes, so that's why I find creating that table, that matrix so helpful. It's perfectly fine if you identify core functions at the system level, then at the healthcare provider level, and then at the patient level. In fact, we have done some of that work in my arrow one using Prism, where we use the different 4 buckets to then identify what are the goals for system change. What are the goals for change at the patient level based on their characteristics, for example? And then you map what will be the goals of those at each of the levels. And it's perfectly fine if there is overlap. Yes, you mentioned it could be overlap, increased bonding for caregivers and children. I will put them perhaps in family level. But for health professionals, they are going to meet that core function, for example, by increased skill set on bonding techniques. How they're going to do it, that will be part of training. For families, that will be, home visits. We role playing, just to say something. In the 2019 paper, we also mentioned that some of the forms can also help you reach more than one core function. And you can use graphs, and even we have done it with in person with the sticky notes and just in our tables doing lines across and within. And one of the key goals is that it helps you map the landscape, so it becomes a little more concrete, and for you to then decide what is it that you can evaluate. You don't have to evaluate or include in your research everything in that matrix. So one goal could be to map the landscape. Another goal is for you to decide with your team, okay, we're going to focus on 2 overlapping core functions that you just mentioned. We might not be able to address change at the system level. And in fact, we can in our project, but we map it. And it just helps us have a better view of the full landscape, and we check on that matrix on an ongoing basis. Has anything has changed with the tracking tool? So I think if I'm answering your question, yes, you can overlap. Yes, it's fine if forms can help carry out several functions, and functions can be at different levels. And that's part of the helpful of the matrix, that you can map those. Then you can decide what would be a best design, because you have interdependence. So that is tricky, and that's an area we're focusing with CCIS action group, and what would be the best methodology to assess it with rigor. So adaptive designs, multi-level models are also helpful, but that could be the next step. How do you incorporate this knowledge into informing your study design?
So thank you. We're having a lot of good discussion coming up, and at the risk of being a little overly controlling, what I'd like to do is try to summarize the key questions that are coming up, let you respond, Monica, and then others can jump in here if either we didn't get it, if I didn't adequately capture the question or whatever. But I'd like to start out with one, and then I think Prachakta may call her out after you respond, Monica. But throughout, there's been questions about applying functions and forms to implementation strategies. How does that fit in? You've talked about in the definition, talks about using this for interventions. And then I think in the definition, you actually have given examples of different implementation strategies can be forms. But how does the concept work for strategies too? Can you define functions for strategies? And maybe again, Prajakta's talking a little bit and has a reference. So maybe if you could start out, then we can have Prajakta take herself off mute and chime in too, and then see where the group wants to go from there.
Love it. Yes. Great question. I would love to hear from Prajakta what you can contribute. So absolutely, yes, you can apply these concepts to what we call interventions in our field, which are strategies. So you can think of a strategy as an intervention, and there has been already some work done by Baron Powell, Carol Lewis, Brian Midman, Brian Weiner and others, including Ross, on better defining mechanism of change for the strategies. And I think it's an area where we still need more work. So you can link the mechanism of change for the strategy. For example, if you are doing audit and feedback, why are you doing audit and feedback? That question always helps me go back. Why would you do that and not something else? Well, we really need to increase a level of awareness of performance. That could be your core function for the strategy. And then the form is audit and feedback. So that's one point. Yes, you can apply it. You will have to flesh out a little bit more the strategies, the mechanism and a logic model, either by JD or others, can also help you to set up a logic model in terms of your strategies and even the intervention, what are the core functions, and then what are the activities of the strategy. Something to keep in mind, in my experience, funders get very confused when we have tried to do that. So in my experience, I have perhaps could do better on applying fully functions and forms for strategies. Where you do it for both, reviewers tend to get confused and overwhelmed. So just keep it in mind. We tend to do it without saying it, but we focus on the intervention to map the intervention. So keep it in mind. I think we're still in this space where we need more work. And the third one is the current ERIC list. And I know others have acknowledged, has a mix of functions and forms in the list, and that could create confusion. Some of the ERIC strategies are pieces of functions, some are forms, some are only functions. And I know Brian Midman was leading some work on mapping the ERIC list based on functions and forms. And I don't know where that work is. And I would love to hear from Prajakta, what are your thoughts? What is your work? Anyone working in this space?
I think the last part is where I was focused on is as the field is getting much and much clearer and thinking about what is a strategy versus an intervention. One of the things that we did, Borshaka and I were working on this projects, is cross projects looked at what are the activities people were doing to promote implementation. And then it was Borshika, me, and Melinda Davis who sat and looked at those activities and said this was a strategy versus this was not a strategy. And the primary way in which we did that is what is the function that this strategy is achieving, this activity is achieving, right? So in doing so, we realized that the ERIC strategies, like you said, had like some were forms, some were functions, right? So we definitely saw that. The Picori RAND list that came out around effectiveness of implementation strategies was really helpful in clarifying some of that. But I think I would be very interested in understanding where the Brian Mittman work is, because I feel like that is really needed to solidify our strategies. I'm very wary of going down the mechanism route yet, because it can get very overwhelming for our partners and our funders and our our folks. They barely can get to a distinguishing between the intervention and the strategy. And then if I bring in the mechanism, I think like I just have people nodding off in the audience all the time. But of course, like you said, and this was like our philosophy when Borshik and I did this as well, is to keep some of this academic exercise to us as scientists that can interpret empirical data and contextualize it to our literature that's surrounding. So I do think that, but I would be very interested in understanding and better classifying forms and functions of the ERIC strategies, because I think that would really advance our science of strategies much more and make it more concrete.
Thank you, Projecta. And I just want, before Ross, I just want to briefly say, Project, I'm happy to follow up with Brian on where that work is, because that was about a year ago, and then connect you, keep you up to date. We need that work. Thank you. Yes, go ahead, Ross.
That's super. Just editorial comment, then we'll move on to Kelly's issue, which I think is a fundamental one here. But both of you in the comments you said share one of these issues that I think a lot of us can relate to in terms of either reviewers, people in the audience. There are a number of subtleties and nuances here, like Mónica talked about looking at both intervention implementation strategies. And when you're looking to reviewers, if you oversimplify, just do one, then you get beat up. On the other hand, if you try to show all the details or go down the road, and particularly my experience, like Prajakta just said, to tie in mechanisms like this, then you overwhelm and confuse everybody, or they pick it. So it's kind of a damned if you do and damned if you don't situation often with that there. But with that, let's turn Kelly and then others related to this too. Mónica, kind of the fundamental issue, how this relates to, for most of us, maybe not all, because as you mentioned, Penny Haw started the functions form a long time ago, but many people are used to the more conceptualization, I think, of core components of an intervention instead of functions. So could you talk with us about similarities and differences between core functions and core components of an intervention?
Yes. So I was trying to see if I could find, in terms of components, I saw Kristen's comment. Was it Kristen or Kelly? Yes.
Yep. We've been going on. People have been going back and forth since early on, so trying to integrate some the questions together.
Okay. Yes. Oh, I had a graph. If I can't find it, it's fine. I really want to show you the graph. Okay, I think I found it. Okay. Yes, I found it. So I'm going to share this graph very briefly because it has not been published, but I wanted to share where we are with that. So huge dilemma and ongoing discussion. What is a function? What is a component? Are they the same? The jury is out, in my view, Kelly and others. Great question. What I did is I brought a group of amazing colleagues, and we are about to submit a commentary piece in this area, kind of dispelling some confusion and functions and forms. And this is one of those discussion points. What is the difference between a core function and a component? Some may say they're the same. I don't agree, and I hope my group of colleagues that include Ross, Penny Hall, Brian Midman, and Borshika and Stellar team, we put together a commentary on explaining the difference. I think we still need to work on making it sharper and clearer, but in a nutshell, so the core functions, we talk about that. The components are the different areas where you are working to support those core functions and forms. So, for example, if you're working in psychosocial screenings in primary care, I work in that area. The core functions are to identify needs, link families to services, and close the loop between primary care and community health services. How that's done? The first one is with screenings, once a yearly screenings, for example. The components are the areas where you need to kind of navigate to make that happen. So it could be policy. In California, there is a new policy called ACEs Aware, where clinics are getting reimbursed every time they screen for adverse childhood experiences. So a component could be that policy support, the technical assistance space, the workforce, the different areas that you need to have feasible core functions, but also make sure that the forms are actually happening. I know it's still a little bit vague, and we are working in this area, but let me share a quick table from this piece with an example. And again, I'm hoping to be able to submit in the next 2 weeks. So again, from our team's perspective, they are different. Some may disagree. And I'm still working with all of us to make this as crisp and concrete as possible. So think about components as presented in the literature are having to do with training and toolkits, consultations, technical assistance. The different areas where you need to pull from expertise, infrastructure, resources, to then have core functions of increased skill set, or increased knowledge transfer, or increased implementation capacity. And the forms could overlap with components, but not necessarily, because they are more specific. It has to do with developing toolkits. It has to do with ongoing coaching sessions and site visits. So that's where we are pulling components as a separate area from core functions. If you don't have the ability to bring consultants and the ability to pay them and to identify them, your core functions and forms might be low quality or may not happen. So the components are a way to facilitate these two areas for you to identify them and also make them measurable and feasible and evaluate these areas. Component has to be, as I mentioned, with the infrastructure, resources, organizational culture, broader, still kind of abstract concepts for some that you will need to support your core functions and forms efforts.
So thank you. I'm watching the time here. Sounds like we could take a couple hours to talk about this great
I know,
issue.
we're still working on that.
Referred to this. Let me just call out Kelly, or let her to take herself off mute briefly to do this. And I know it's the start of a conversation. I'd like to save time to do at least one other issue too. But obviously this has resonated with a lot of people. So Kelly, do you want to jump in briefly and share your thoughts?
Yeah, no, thank you. I'll be brief. I don't think it's a minor issue at all. And our team is in the middle. I'm asking because we're in the middle of conceptualizing core components of an intervention that's been implemented widely, but we're back in the field looking at long-term sustainment and trying to understand what core components have been sustained. And there's, as you know, there's a long-standing literature in psychology, in psychosocial interventions that has talked about how it's not implementation scientists and design it. It's long-standing, beginning with our colleague Gary Bond and a team that did evidence-based interventions research where you identify core components that helps you identify fidelity measures to an intervention and then helps you identify adaptations. So we've been looking at the literature on core components, and it sounds a lot like some of it sounds a lot like core function. So I'm just trying to work myself and being clear. And I think it matters when what grant you're, who you're submitting to. So at NIMH, where I served on plenty of study sections, introducing a new thing like core functions that means essentially the same thing as the core components, which many of us in behavioral health are used to understanding. It's like, what's the value in that space versus implementation scientists maybe looking for core functions. So I don't think it's minor. I think it's, as Russ, you said, an ongoing discussion about how it relates. I like that table you just presented, Mónica. It would take me a while to look at that and sort of absorb it and try to think through what I know about both. But it's really important, and I'm glad you guys are thinking about it. We are too. So thank you. I'll stop there. I know you have other questions.
Sounds like this would be a good discussion to continue. Maybe Mónica and you can continue offline, or at what point she feels comfortable sharing this paper and getting your reactions to that too. So thank you all. That's great. And I feel really bad needing to be the time cop here and cut off a great discussion. But go ahead. At least one other issue I think that both I feel has come up and mentioned something here, Mónica, is during implementation program, particularly if it's a longer term one, often I think there's a change, or at least I'll say I've seen in that a change in forms over time. Often you find out one thing isn't doing, and this is an adaptation that's made as we go on there. So I'm just wondering if there's a system. Of course, it brings up the issue of when is it actually a change in a function and when is it just a form doing that. But I'm wondering if you have a tracking system or a recommendation when for looking at change in forms anyway over time during a program. Oh, I think you're off. You're still on mute now.
Okay, so I just finished answering all the questions. It was perfect, Ross, but I was on mute. Never mind, just joking. In a couple of minutes, yes. So this tracking sheet, we have used it in an NIMH R21 project. We use ongoing coaching with care teams in FQAC clinics every 5 to 6 weeks, sometimes 4, depending on their needs. We met with them and we presented what we agreed during implementation mapping. Maria Fernandez was part of that effort, and we started there. Remember, we agreed that for ACEs screenings, here are our goals, and here are the things we agreed we were going to do. And then we use these. I use it in an Excel, but you can use it here to complete, and they will see their input as we were typing in Zoom. That was during COVID, so it was not in person. Here, we asked them, have there been any changes in the goal? I don't mention core functions. I mention goal. I know Maria and others have said that might not be the best word, but I haven't found a better word. Core function is not going to resonate with a nurse or with our partners. But we check, are these still your priorities? Are these still goals that you are pursuing? Remember, this is a complex system. And part of the self-determining is that they might drop some of the core functions and move on or focus on others. And that's a problem for evaluation and implementation. So we always check with them, are you still using them? Are they still a priority? And it's fine if they're not, why not? And then we check, similar as Mary and others, here are the activities that we decide for this goal. Have there any of these activities changed? Are you dropping any? Who made the decision? Similar as what Borshik and others have done, our other colleagues. But we did track using a concrete form on relevance of core functions, any changes there. Here are the activities, any changes, similar as we do with adaptations. Who decided? How is that different? And we did it for each clinic. We then PDF that table and share it with our partners, and that became one data point. And then we look at from the last one, last time we shared this, anything has changed. So that's how we have tracked both core functions and forms.
Super.
Over our
That's
time.
great. I know time's up. That is super. I also love that you looked at changing in priorities, which is something that I see over time too, not just the
Yes.
activities or forms that are done. So listen, we're over time. Thank you, Monica, for an incredible presentation. And thank you all of you for your engagement and great feedback and things. And we'll look forward to seeing you, hopefully, most of you next time. And again, thanks so much, Monica, and congrats on this exciting new work.
Thank you. Great comments. Thank you so much.